Everyone gets headaches. It's totally normal to feel that throbbing pain in your head after a long day staring at a screen or when you're feeling super stressed. But what if your headache is telling you something more? What if it's a sign that something else is going on? In this video, we're going to break down the different types of headaches, from the everyday tension headache to the more serious ones that need immediate medical attention. We'll talk about the warning signs and symptoms you should never ignore. Because remember guys, knowledge is power. The more you know about your body and how to recognize potential problems, the better you can advocate for your health. So, let's dive in and learn how to tell if your headache is something you can treat at home, or if it's time to see a doctor. Alright, let's start with the most common type of headache, the tension headache. Ever feel like there's a tight band squeezing your head? That's a classic tension headache. They're usually triggered by, you guessed it, stress. Think about it. Deadlines at work, arguments, even just everyday worries, they all take a toll on your body. And that tension often manifests as a headache. Now, tension headaches aren't usually serious, but they can be a real pain, literally. They usually feel like a dull, aching pain that wraps around your head. It's not usually a throbbing pain, and it's often on both sides of your head. Along with stress, other things like poor posture, eye strain from staring at screens for too long, and even dehydration can cause these headaches. The good news is, tension headaches usually respond well to simple lifestyle changes and over-the-counter pain relievers. But if your tension headaches are chronic, meaning they happen frequently or last for a long time, you should definitely talk to your doctor. Now let's talk about migraines. Migraines are a whole different ballgame than tension headaches. They're often described as a throbbing or pulsing pain, usually on one side of the head. And trust me, if you've ever had a migraine, you know it's not something you can just push through. Migraines can be incredibly debilitating, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Some people even experience visual disturbances like flashing lights or blind spots before the headache hits. These are called auras. So what causes these monster headaches? Well, it's complicated. Experts believe migraines are caused by a combination of factors, including genetics, changes in brain activity, and even environmental triggers. Some common migraine triggers include stress, again, hormonal changes, certain foods and drinks, and even changes in weather patterns. The key to managing migraines is to identify your individual triggers and try to avoid them as much as possible. Okay, so we've covered tension headaches and migraines, but now, let's talk about the serious stuff. Most headaches are nothing to worry about, but there are some red flags that should never be ignored. If you experience any of these symptoms along with your headache, it's crucial to seek medical attention immediately. First up, sudden, severe headaches, often described as the worst headache of my life. This type of headache can feel like a thunderclap going off in your head, and it can be a sign of a serious underlying condition, like a stroke or a brain aneurysm. Next, be on the lookout for headaches accompanied by a fever and a stiff neck. This combination of symptoms could indicate meningitis, which is an infection of the membranes that surround the brain and spinal cord. Also, pay close attention to headaches that start after a head injury, no matter how minor the injury may seem. A headache after trauma could be a sign of a concussion or other head injury. And finally, any headache that comes with neurological symptoms, such as vision changes, confusion, weakness, or difficulty speaking, requires immediate medical evaluation. These symptoms could indicate a stroke, a brain tumor, or other serious neurological problems. Remember guys, when it comes to your health, it's always better to err on the side of caution. If you're ever unsure about a headache, don't hesitate to reach out to your doctor or seek emergency medical attention. I know talking about brain tumors and aneurysms can be scary, but it's important to be aware of the signs, even if these conditions are relatively rare. Let's start with brain tumors. Headaches caused by a brain tumor are often described as dull and persistent, and they tend to get worse over time. They may be worse in the morning or wake you up at night. Other symptoms that might accompany a brain tumor headache include nausea, vomiting, seizures, and changes in vision, speech, or balance. Now, aneurysms. An aneurysm is a weak or bulging spot on a blood vessel in the brain. A ruptured aneurysm can cause a sudden severe headache that feels like a thunderclap. Other symptoms of a ruptured aneurysm include a stiff neck, nausea, vomiting, sensitivity to light, and loss of consciousness. It's important to note that not all brain tumors and aneurysms cause headaches, and not all headaches are caused by these conditions. But if you experience any of these symptoms, it's crucial to seek medical attention immediately. Alright, let's switch gears for a moment and talk about two other types of headaches you might encounter: sinus headaches and cluster headaches. Sinus headaches are often mistaken for tension headaches or migraines, but they have a distinct set of symptoms. As the name suggests, sinus headaches are caused by inflammation or infection in the sinuses, which are air-filled cavities in the skull. Along with a headache, sinus infections usually cause facial pain and pressure, a runny nose, congestion, and sometimes even a fever. Sinus headaches typically cause pain in the forehead, cheekbones, and bridge of the nose. Now, cluster headaches are a whole other beast. They're incredibly painful headaches that occur in clusters, meaning you experience multiple headaches over a period of days, weeks, or even months, followed by periods of remission with no headaches. Cluster headaches are much less common than other types of headaches, but they're known for their intense, sharp, burning pain, usually located on one side of the head, often around the eye. These headaches often come on suddenly and can last anywhere from 15 minutes to 3 hours. Other symptoms might include a red watery eye, drooping eyelid, and a runny or stuffy nose on the affected side. Chapter 6. When to see your doctor. Don't ignore the signs. So, when is it time to pick up the phone and make an appointment with your doctor about your headaches? Good question. While most headaches are nothing to worry about, there are some situations where it's best to get checked out by a professional. First and foremost, see a doctor if you experience a sudden, severe headache that comes on like a thunderclap. I can't stress this enough, guys. This type of headache requires immediate medical attention, as it could be a sign of a serious underlying condition. Also, make an appointment if your headaches are becoming more frequent or severe over time. This could indicate an underlying medical condition that needs to be addressed. If your headaches are interfering with your daily life, preventing you from going to work or school or participating in your usual activities, it's time to talk to your doctor. And of course, if you're experiencing any neurological symptoms along with your headache, such as vision changes, weakness, numbness, or difficulty speaking, seek medical attention immediately. Remember, guys, you know your body best. If something feels off or you're concerned about your headaches, don't hesitate to reach out to a healthcare professional. Chapter 7. Headache Prevention, Simple Steps for Relief. Now that we've covered the different types of headaches and when to see a doctor, let's talk about what you can do to prevent headaches from happening in the first place. One of the simplest yet most effective things you can do is stay hydrated. Dehydration is a common headache trigger, so make sure you're drinking plenty of water throughout the day. Next up, prioritize sleep. I know I sound like a broken record, but getting enough sleep is crucial for overall health, including headache prevention. Aim for 7 to 8 hours of quality sleep each night. Another important tip is to manage your stress levels. Easier said than done, right? But seriously, stress is a major trigger for both tension headaches and migraines. Find healthy ways to manage stress, such as exercise, yoga, meditation, or spending time in nature. And let's not forget about our trusty screens. Staring at computers, phones, and tablets for prolonged periods can lead to eye strain and headaches. Make sure you're taking breaks to rest your eyes, and consider using blue light glasses to reduce eye strain. Finally, pay attention to your diet. Certain foods and drinks can trigger headaches in some people. Common culprits include aged cheeses, processed meats, alcohol, and foods high in MSG. By making these simple lifestyle changes, you can significantly reduce your risk of experiencing headaches and improve your overall well-being. Chapter 8. Listen to your body. Your health matters. We've covered a lot of ground today, guys, from the common cold to more serious conditions. But the most important takeaway is this: listen to your body. Your body has a way of telling you when something's not right, and headaches are often a sign that something is out of balance. Don't ignore your body's signals. Pay attention to how you're feeling, and don't hesitate to seek medical attention if something feels off. Remember, you are your own best advocate when it comes to your health. The more you know about your body and the potential health issues you might encounter, the better equipped you'll be to make informed decisions about your care. So, stay informed, stay proactive, and take charge of your health. So, there you have it, guys. The different types of headaches, what they mean, and when you need to get them checked out. Remember, most headaches are no big deal and can be managed with simple things like hydration, rest, and over-the-counter pain relievers. But if you're ever experiencing a headache that's different from your usual, is super intense, or just doesn't feel right, don't hesitate to get it checked out. As always, this video is for informational purposes only, and is not intended to be a substitute for professional medical advice. If you have any concerns about your health, please consult with a qualified healthcare professional. Stay healthy, and I'll see you in the next video.